Yes, great to see so many people here interested in this topic. So I'll be talking, taking the next step or taking the baton in this series of outstanding lectures and talk a bit about the development of the global expert survey infrastructure and other international efforts and the rationale for this. I have a listing of disclosures with respect to pharmaceutical, gambling, gaming, and legal entities. And I thought it would be good for us to put all of this into context that as we've heard about throughout the morning, addictions impact people globally. And there may be different aspects across different jurisdictions, cultural aspects, policy differences that may create differences across different groups of people. And to date, most, if not much research that has been conducted has largely focused on so-called weird populations, white, educated, industrialized, rich, and democratic groups of individuals. And if we're going to really make integrated or focused advances in addiction medicine across different jurisdictions, it will be important for us to involve a more diverse group of individuals globally. And so over the past several years, I think the world has been impacted and perhaps impacted in some similar and some different ways by the COVID-19 pandemic. And this has led to a number of stressful changes for many individuals relating to health, finances, and other aspects of daily living. And in this time when people are experiencing much stress, sometimes people turn to maladaptive coping mechanisms, including engaging in addictive behaviors. So having an understanding of the impact of this novel environmental situation that we were all put in was going to be important, we thought. And we thought that the International Society of Addiction Medicine was in a unique position to try to gather information to help us help people. And so early on in the pandemic, ISAM generated several webinars. So in March, April, and May of 2020, Hamed Ekhtiari and others pulled together a group of webinars that included people from around the globe, included leaders from like Nora Volkoff, the director of NIDA in the United States, as well as Vladimir Pozniak, the person who is directing addiction-related work at the World Health Organization, to try to convene people and share information and share ideas so that we could best address this new global situation. And Hamed and his team has really been outstanding in terms of gathering the information and putting it together so that it is accessible over time through the ISAM YouTube network. During this time, Hamed and others spearheaded this set of global surveys of substance use disorder practitioners. So Alex also was part of this spearheading process. And this led to the gathering of information and then the dissemination of the information through peer-reviewed publications. So this is one of the first publications that was generated that focused on changes in supply, price, and use of illicit drugs and alcohol and related complications early during the COVID-19 pandemic. And like the global expert network that Alex was mentioning, this survey involved a large number of addiction medicine service providers, 177 individuals from 77 different countries. And the data that were presented, that were collected and then analyzed and understood, suggested that there were decreases in drug supplies, increases in drug prices, increased use of alcohol, cannabis, prescription opioids, and sedative hypnotic drugs, as well as decreased use of stimulant drugs like cocaine and amphetamine, as well as opiates. And this was based on the experiences of the substance use disorder practitioners who participated in the survey. And again, early on in the pandemic. Another publication, again, from data collected early in the pandemic, focused on how substance use treatment practices and harm reduction services were impacted early during the pandemic. And again, the same group of individuals from the 70+ different countries were surveyed. And the data suggested that a vast majority reported that they were still able to continue care for people with substance use disorders, but there were a substantial number, 3/8 of individuals reported that there were shortages of some medications that are used to treat individuals with opioid use disorders, such as methadone or buprenorphine. And over 40% reported that there was partial discontinuation of harm reduction services. So the pandemic at the early point in time was impacting the care that was being provided to people around the globe. There are also negative impacts reported on overdose interventions and outreach services in a majority of individuals who participated. So I think we'll hear more about the Global Expert Network, but I think that just using the onset of the pandemic as an example, it cites the importance of bringing together globally experts who can help gather information, particularly at times when there are rapid changes in the environment. So being, prevention may be best addressed when people are prepared, and having a global expert network develop will allow us to intervene in a more timely fashion to future crises should they occur. So we've also at Yale, through our Yale Institute for Global Health, have been putting together a global addiction faculty network where Marc and David Filene are spearheading this effort. And then with ISAM and other groups, we've also been involved in other educational initiatives. And this focuses on this next set of webinars that Scholt Demetrovich and I have been organizing in conjunction with the Centers of Excellence in Responsible Gaming and that in gambling research, as well as the International Society for the Study of Behavioral Addictions and ISAM. We've put together a series of webinars. These have focused on various aspects of gambling around the globe. So the first webinar, we included speakers from Asia, from Europe, and from North America to give some examples about some of the gambling policies and regulations that existed and how that impacted people's gambling behaviors. We subsequently had, again, an international group of speakers, largely from North America, focusing on how different gambling interventions were being put into place in gambling venues in these jurisdictions. And we have upcoming in a couple of weeks a series of series of talks that focus on how industry and academia might work together in different ways. But we've also been involved in trying to gather information from a large number of jurisdictions on a variety of behaviors some of which have focused on internet use behaviors. So, for example, Joël Beaulieu and Maeva Flael led a binge watching survey that involved a double-digit number of countries. Those data have been published. Beate Botha and colleagues have been conducting an international sex survey involving 45 different countries, and Tanya Moretta and Shubao Chen are spearheading a social media survey. And if people are interested about potentially participating, for example, in the social media survey, which is the last of the 3 that has been initiated, please feel free to reach out to me. So we've also been involved with the World Health Organization, not only through webinars, but there's been a group that has been convening over the last 8 years to consider internet use and behavioral addictions. And this has led to some considerations of how the ICD-11, the 11th revision of the International Classification of Diseases, considers disorders due to addictive behaviors. An ongoing work with the World Health Organization is trying to develop instruments that will be diagnostic as well, diagnostic instruments for gaming disorder, for example, as well as for hazardous gaming, which is a new entity within the ICD-11. And these instruments will be along the lines of the audit that the World Health Organization has generated and is and now in use worldwide. We hope that there will be similar instruments for behavioral addictions. We also think that there's a wider range of behaviors that might be considered as the focus of addictions, shopping, buying, social media use being a couple of behaviors that are not currently the focus of specific disorders, but may be considered as other specified disorders due to addictive behaviors. I've mentioned the ongoing instrument development. And I thought it would be good for us to also think about how some of these behaviors might differ across jurisdictions. So this is a meta-analysis that we conducted looking into over 30 different data from over 30 different countries, looking at gender-related differences. And we found that overall, across different jurisdictions, internet gaming disorder showed a male predominance. Social media addiction or problematic use of social media showed a female predominance, and internet addiction was in between the two. But not all jurisdictions showed this pattern. So there were some countries, for example, India showed the opposite gender pattern, and Germany and Taiwan showed differences with more male predominance for both behaviors. So I think it will be important for us to understand in specific jurisdictions what factors might operate to lead to these apparent differences. And there have been some other initiatives, for example, European Cooperation in Science and Technology Initiative or COST initiative that is focused on problematic use of the internet. During the pandemic, we generated an initial consensus guidance on how to prevent problematic use of the internet. We also generated a practical electronic booklet or e-booklet titled Learning to Deal with Problematic Usage of the Internet, and one can download this for free at www.internetandme.eu. And this idea of working together across different societies is something that ISAM is reaching out to a number of different societies and trying to work together. Earlier, I was involved in working with the International Society for Research on Impulsivity, as well as the International College of Obsessive Compulsive Spectrum Disorders, to think about how impulsive and compulsive tendencies may relate to addictive behaviors and how we might best define these constructs from an expert consensus perspective. And so this led to several consensus statement manuscripts on how to define, measure rapid response impulsivity, and then understand the clinical implications, as well as a separate construct of choice impulsivity, and then how we might consider compulsivity from a clinical and biological perspective. So together, I thought that these are several different examples of how different groups might work together and highlight the importance of efforts like ISAM-GEN to bring together groups of individuals, experts from around the world, so that we may be better in a better position to understand people with addictions from different jurisdictions, and then translate that information into better prevention and treatment efforts. So I'd like to thank you all for your attention. Thank people like Alex and Hamed and many others, as well as funding agencies. So thank you.